What is the best sodium intake for stroke prevention? When it comes to stroke prevention, sodium intake plays a significant role. Health experts recommend limiting sodium consumption to less than 2,000 milligrams per day, which is about 5 grams of salt. This guideline is supported by major health organizations like the World Health Organization, the Centers for Disease Control and Prevention, and the American Heart Association. The reason for this recommendation is clear. High sodium intake is linked to elevated blood pressure, a major risk factor for stroke and other cardiovascular diseases. By reducing sodium intake, individuals can lower their blood pressure, which in turn decreases the risk of stroke. The World Health Organization advises adults to consume less than 2,000 milligrams of sodium daily, a level associated with a reduced risk of cardiovascular disease and stroke. The American Heart Association suggests an even lower target of no more than 1,500 milligrams per day for most adults, especially those at higher risk for hypertension and stroke. However, they also state that not exceeding 2,300 milligrams daily is acceptable for the general population. Many people consume for more sodium than these recommendations. Average intake often reaches around 3,300 to 4,300 milligrams daily, primarily from processed and restaurant foods rather than from adding salt at the table. While some studies suggest a sweet spot for sodium intake between 3,000 to 5,000 milligrams, this is less consistent with stroke prevention guidelines, which emphasize lower sodium levels to manage blood pressure effectively. Even a modest reduction in sodium intake can yield benefits. Cutting back by just 1,000 milligrams per day can improve blood pressure control and reduce stroke risk. So, how can you achieve this? Start by focusing on a healthy dietary pattern that limits processed, packaged, and restaurant foods, as these are major sources of hidden sodium. Reading nutrition labels is essential. Look for low sodium options when shopping. Incorporate fresh or frozen vegetables without added salt into your meals. Choose fresh meats over cured or processed varieties, which often contain high sodium levels. It's also important to remember that sodium can be present in many ingredients beyond just table salt, such as sodium nitrate or monosodium glutamate. Summary: to effectively prevent stroke, adults should aim for less than 2,000 milligrams of sodium daily, with an optimal target closer to 1,500 milligrams for those at higher risk. This reduction in sodium supports better blood pressure control, which is the most effective dietary strategy for lowering stroke risk. Always consult healthcare professionals for personalized advice, especially if you have existing hypertension or other stroke risk factors.